using the KDI software. And once you've turned on the Pano machine, brought up your computer, one of the first things you want to do is you want to check to make sure you have a folder for today's event. If not, then you need to right click on the screen, anywhere on the screen. You're going to scroll down to New, click on Folder, and you will name your folder. And in this case, we'll just name it, it's always going to be your event site, so we're just going to use Austin, Texas. And then you put today's date, starting with the month, the dash, the day, dash, and year. And simple as that. And what I like to have my Pano assistants do, or what I tell them when I'm training, is open this folder and enlarge that, and just keep it minimized and keep it down here on the lower part of the screen. It's easy to check when you start to save your files into that folder. It's easy to check to make sure that you saved them in there and saved them correctly. Now the next step would be to come up here where the big red and yellow Kodak icon is. You're going to double click on that, and it's going to open up this screen. Now you're either going to go to this icon for the new, or you can click on patient and click on new, and that opens up this block for you to fill in patient information. Now for our purposes, and this is also for the purpose of having the social and name printed out on the image, when you go to print this out, we ask that you put their social in the last name block. And you will put the social with dashes. And remember, the reason you're putting that in there is so the social and name prints out on the image that you print out to give to the soldier. So that once you get to the first, then you go to the first name block, and here's where you will type in their last name, comma, first name, space, and a middle initial if they have one. And once you've got those two blocks filled, that's all you need. You come down here to click OK, and then you're going to come back up here to this icon, which is the imaging icon, or you can again go to patient, scroll down to imaging, click imaging. This will now come to this big black screen, and you're going to have a big black screen here. And then what you need to do is you need to scroll up here to this icon which says new panoramic image. Some look at it and say the smiley face. Some people say it looks like a printer keyboard or a computer keyboard, however you want to look at it. But this icon right here, click on that, and that will now bring you to this screen. And one of the first things you may want to look at is you want to come down here and you want to look down here where it says your KVs and MAs. If it is on 16.4, that is due to the regional Pano coordinator setting up this machine and taking the test shot, and he did not reset this. This is a setting for their test shots. Do not try to use this setting. The best thing to do is you go up here to these screens and you do one of two things. You can come up here to patient, and then you make sure it's on the adult image and basically on the average body weight. And what you do is you click on that, make sure it's on that, and as you notice, it changed the KV and MAs. And this is fine for, say, somewhere around the neighborhood of 30 or less panos expected for the day. You should be alright. If you have a large event, we often ask you to make sure you go to the parameters, and here you can manually set, and we like you to push preset to 70 and 10. Set it to 70 and 10 MAs. This will help maintain coolness of the machine, and so that it has a tendency not to overheat for you, hopefully. And this is usually enough KV and MAs to take that on an average person. One of the other things you want to look at is down here. You have this little demonstration without X-ray button. Right now it's on. That means the tube head is activated and ready to take a Pano. If it is in the off position, your Pano machine will rotate but will not take a Pano. So you may want to make sure that this is on. You want it to make sure it says on. Another thing you may want to look at is the cooling time here. Right now they're on 00. The Pano machine is cool, ready to take an image. If there are numbers in there, and they're usually counting down backwards, that means the Pano machine is starting to heat up, and you need to allow that machine to finish cooling down and go back to 0 prior to taking the image. In most cases it will not let you take the image, and sometimes it will, but always let it 0 out prior to trying to take your image. Now another thing you'll notice is over here in this one screen here, information messages, it is telling you it's the wrong arm position. That simply means that the C arm has to be reset to its home position prior to taking an image. And so what you want to do is you want to look at this little ring right here. That's your ready status indicator. Notice it's black right now. If you come over to this icon button right here, which is the movement reset, click on that, the Pano machine will start to rotate back to its home position, and you will then notice that this ring here will go to green, and we are back in position, and a green ready light indicates that it is ready to go. Just for information purposes, this is your laser beam control. Basically it's your patient positioning lights. You will find both these buttons, these two buttons right here, the laser beam and the movement reset buttons, are identically the same on the front panel of the Pano machine. In most cases you will only use this button here at the computer. So once you've done that, it's recommended you come back up here, click to program, make sure that this smiley face right here is all encased in white, and you are now ready to take your Pano.